data-driven precision health. Ooh. Dr. Goldstein holds an MD and a Ph.D. in immunology from Harvard University. You're a busy guy, Steve. Dr. Goldstein is joined today by Chad Leftrip. As Chief Executive Officer of UCI Health, Chad oversees Orange County's only academic medical center and all clinical and patient-serving operations, including the UCI Medical Center in Orange County and ambulatory sites across the country. UCI Medical Center has been listed among America's best hospitals by U.S. News and World Report for 20 consecutive years. It is OC's first magnet-designed hospital for nursing excellence and has been redesigned three additional times, a feat accomplished by less than 1% of the nation's hospitals. It operates the country's first National Cancer Institute designated comprehensive cancer center and the only level 1 trauma center. Dr. Goldstein, would you like to start us off?
Absolutely. Well, shalom. It is a great pleasure to be with you today. And thank you so much for inviting us and hosting the event. So today I will briefly share in the 4 hours you've given me some amazing developments taking place at UCI. And my goal is to describe why it is so special, so fortunate that Orange County has an academic health system. And of course, that's what UCI Health is. It is the only academic health system serving the 3.2 million people in Orange County. And many people don't appreciate why an academic health system offers so much to the community. It's different than a great community hospital like Hoag. It's different than a non-academic health system like Kaiser or City of Hope. So I want to share that because you own us, we are you. And then I'll hand over the reins to my extraordinary CEO. So let's start. I'd love to show you an example of our work through a video. So Ryan, can you start that?
Breaking developments. Coronavirus is now considered a global health emergency.
A global health emergency.
A global health emergency.
Drastic measures taken as cases spike.
The first case of the deadly coronavirus has landed in Orange County.
We direct a statewide order to stay at home.
Stay at home.
Stay at home.
Stay at home.
Students at UC Irvine will have to say goodbye to whiteboards and lecture halls. Classes will move to online courses.
It was created by students and staff at UC Irvine.
The app Track COVID. It's in the works here at the University of California, Irvine.
UC Irvine is leading a study in Orange County to see how many have antibodies for COVID-19, and knowing that can direct the county's work to contain the spread.
Researchers from UC Irvine are working to try to find out just how prevalent the coronavirus is here in Santa Ana.
A big show of support today for doctors and nurses and the medical staff at UC Irvine Medical Center.
Special drive-by parade to show unity and support for the medical staff. Even though the salute was from a distance, they were able to touch hearts and lift spirits for those who are working long hours to get patients healthy.
These are my peers. Say hello, everyone. Those are my professors.
For social distancing reasons, match day at UC Irvine, they had to do it all by video conference this year.
A group of UC Irvine medical students are leading the way to help the staff at UCI Health by collecting medical supplies for the hospital.
Medical students at UC Irvine are banding together to help their teachers and mentors during the coronavirus crisis.
A team of UC Irvine students who are here because they want to give back to the community. It's the first facility of its kind to go up in the county during this pandemic.
Deliveries of the COVID-19 vaccine started arriving here at UCI Medical Center.
Healthcare workers step up to get the first doses of the vaccine.
Frontline workers have started to get the first doses of the COVID vaccine, medicine to protect our bodies, doses of hope.
Remdesivir.
Clinical trials for a promising drug treatment are underway at UC Irvine.
The monoclonal antibody medication has kept the high-risk patients out of the hospital.
The therapy helps to ease symptoms in COVID-19 patients, and doctors at UC Irvine have a unique way to deliver it.
Scientists at UC Irvine are working on a universal vaccine that could protect against all COVID strains.
So we come out the other side of this, and hopefully we keep heading forward and forward. You know, I'll just say the obvious to all of you: please tell everybody, get vaccinated. I am so proud of what we've done, and that's only a small piece of it. So thank you for letting me share that. Now I want to explain how it is that we can do so much and why we are so unique, and not just as an academic health system, but in America as a unique academic health system. And it has to do with the way we are moving forward and the way we have put ourselves together. So for starters, through the extraordinary generosity of Susan and Henry Samueli, the College of Health Sciences is a first of a kind alliance. Across health disciplines, it merges strengths so that we can have interprofessional education, team-based care, and advance the frontiers of knowledge in a way that's not happening at any other place. Now, some of that is circumstance. There are very smart people at other institutions, but we are standing up next to our great School of Medicine, a School of Nursing, which is now a few years old, Pharmacy and Pharmaceutical Sciences, which is only months old, Population and Public Health, which will be coming in a year, built from many strong programs, and the Samueli Integrative Health Institute, combined with UCI Health, our delivery system, and across that entire enterprise, institutes and centers of health. Whereas most places work in silos, we work together. And that is got to start at the beginning if you want to work together when you're offering care and when you're advancing the frontiers of care. And I'm going to tell you an example based on COVID of what that allows us to achieve. If I can have the next slide. And you can see our mission description is to discover, to teach, and to heal. And the reason that creates a swirl of discovery is because something that we can understand in the university setting, like artificial intelligence, we can apply in the hospital setting and come back and improve it. And this has led to an amazing example. When COVID started, the first patient came in, and we did all of our excellent care to take care of them. But imagine what it's like if you're the physician. You have a patient, and then another physician has a patient, and then the nurse has a patient. And in the old model, slowly over time, people began to talk to each other about what they were learning and how to move things forward. And then you'd come up with a consensus over weeks or months about the best way to move forward. And that's led to very good advances in American healthcare. But what if you took all the data from the first patient and put it in a machine learning algorithm so that all of the healthcare providers saw what was happening. And then the second patient came in and you modified it, and the third and the fourth. And based on that, we built a COVID vulnerability score that tells you whether the patient is likely to end up in the ICU, likely to be on a ventilator, likely to need antibodies. And we sort of have a catchphrase for it now, taking care of the 101st patient. The fact is, 2,500 inpatients later, UCI is ranked among the august group of academic health centers across the state and the country as the #1 in COVID survival across the nation. That's using the smarts to discover, teaching people how to act, and then applying it to heal. Next slide, please. Now, in order to give the best possible care, one of the things you need to do is train the next generation of care providers in this rich environment so they are constantly learning. And this is a great example of the way UCI is always at the front edge of this. Last year, through the great generosity of Sarah and Greg Palmer, we gave every member of the medical school class a handheld echo machine, these butterfly echoes. What that means is they are learning now what the field is going to know how to do in a decade. Not only do they learn what their own heart looks like as they're studying for what comes next, but they know how to apply this to their patients, first in the nation, to move the training forward in that way. Next slide, please. And then, of course, in the Discover, Teach, Heal, if you move back and forth and do it rapidly, you can begin to change things that are longer lasting than this pandemic, we hope. And one example of that is that the first adult bone marrow transplant program and patients are now moving through UCI Health in Orange County at our site. And these are all examples of what we are doing, because there's nothing more fun for me, only being here 2 years, when someone comes up to me and says, you know what happened to me, Steve? I said, golly, I need to see the best oncologist in the world. So I called 3 different people, and I called Sloan Kettering in New York, and they all said, why aren't you going to UCI? It's right there. This is the best care you can get, and it's in your backyard, just like JCC is for us. So now I want to talk about how come we can manage to do it. Next slide, please. Now, one of the ways is because we believe in an entrepreneurial, forward-looking model. And this spin wheel here is an example of just in the last year how we've taken data about patients, which we call the collaboratory for data, and started to work with external partners so that what we discover moves out into the whole world rapidly. And that COVID vulnerability score I talked to you about that has made us #1 in survival, the Health and Human Services came to us and said, please, let us share that with hospitals around the country. And of course we did. Next slide, please. Now, the first part of that Discover, Teach, Heal mission is the research. And again, just to tell you the trajectory of what's happening in your backyard, 5 years ago, we brought in $290 million of external funding for research at UCI. This year, we broke over the $500 million mark. That's the trajectory this university is on for Discover. And part of the strength that we bring to health is the whole university is part of the enterprise. Our School of Computer Science and Engineering and Business and Law, and that all comes together to empower what we're doing in health. Next slide, please. And this is just, again, when people say, how can you do so much? I mean, aren't you a young school? You're not 350 years old like Harvard. How do you even do this? And the point is, the excellence, the entrepreneurial spirit of Southern California. Our chancellor, who looks at us and says, I don't want you to copy anyone. Greatness doesn't come from copying, it comes from inventing. And so you see, we are one of the 65 elite research universities in the country. And we are being recognized by Money Magazine and Forbes and US News and World Report as at the top tier. That's why the environment is so rich. And while I would not like to hitch my fortunes to the decisions that 17 and 18-year-olds make, we have become one of the top tier choices among even the UCs in California for where the students want to go. Our admission numbers our application admission numbers are incredible. Next slide, please. And so we are moving forward. And those of you who drive past campus see that we are already 3 stories up on the building that is being built for the new College of Health Sciences. Next to it will shortly come up the School of Nursing. All of this will be occupied by next summer, not this coming one. Incredibly exciting, where we bring all of those disciplines together, adults and trainees, to move things forward. Next slide, please. And then, of course, what Chad is going to talk to you about, which is bringing all of this to Irvine, expanding what's happening in Orange and at ambulatory sites. So this remarkable cutting edge care is available right here at home and also right on the north part of campus. So the interaction with the campus can really synergize and move things forward. So next slide, please. So now I'm going to turn around and tell you that we need you. We need you because 2 years in, I realized that somehow this is all a secret. Somehow in Orange County, no one knows these stories. Please, you've got to share these stories. You've got to let people know, or have them invite us so we can tell the stories. And then, of course, your support and your introduction to people who can help us finance this, because philanthropy is a driver when you're in a nonprofit environment like this. We can only do many of these things with philanthropic support, and we are $1 billion into our $2 billion campaign. We need your help in that way as well. Next slide, please. So I'm going to transition now to like the most remarkable CEO in the country. And people think I speak in hyperbole, but I mean it. Chad he showed up on April 1st, which I really think we should have appointed him on the 2nd because it was not a joke. He showed up just as COVID was happening to take up the reins with creativity, years of experience, the knowledge to take us to driving towards this new $1.2 billion medical center in the middle of COVID and making everybody understand it was exactly what we needed to do and why we could do it. So we could not be more fortunate than to have Chad Lefteris, and I will hand over the microphone to you, Chad, now.
Thank you, Steve, very, very much. And someday I'm going to make my mom listen to you introduce me. She'll be very proud of that. Thank you. It's so kind. And it is a real pleasure to be with you all. Just like Steve mentioned, part of what I think is that we're the best kept secret in town, and we're changing that. And we actually changed that through this COVID and pandemic experience, because as you probably saw, we were very quickly pointed to as the source of truth and based in fact and science, because we have the experts here. And so we're going to continue to leverage that work, but think about what that can mean for many, many other things across the health needs spectrum. So we're going to dig into first a little bit more about us, just like Steve mentioned, so that you have some of these pearls that you may not know about us, and then dig very deep into this new campus that we're going to create right on the edge of the main campus, as you said, literally in your backyard as well. So let's go to the next slide, please, Ryan. So I won't read all these to you, but these are just some fun facts that you may not know about us. I'll just pick out a couple. You've already heard Steve mention about some of the onlys that we like to talk about, and the only American Burn Association Burn Center, for example. Big deal, but think about what that means to our community. the only NCI, National Cancer Institute designated comprehensive cancer center. A very big deal, one of only 50 in the country that does that. Look at some of the volume numbers, almost 800,000 outpatient visits in fiscal year 2020, and that was part of COVID year, don't forget. So that number was a little bit down. 5,000 FTEs is what we call them, probably close to 8,000 total workforce when you think about our faculty as well as permanent and part-time positions. That's a small city where I come from in North Carolina, by the way. We have 418 licensed beds, and that number is growing as I speak. Right here, sitting in Orange today, we have a new unit that's under renovation that would house another 30 or so beds. And then we'll talk about the new 144-bed campus coming up shortly. But you can see some of the other numbers, and you heard about the magnet designation, super important as it relates to nursing practice and nursing excellence. Let's go to the next slide, please, Ryan. You also may not know that we've been rated by the Institute for Healthcare Improvement, IHI as it's known, as an age-friendly health system. This is something that not everybody gets. You don't just like show up one day and get this in your email box. A ton of work has gone into this from our family medicine and geriatrics programs to make sure that we are taking care specifically of that niche in a different way, and even designing our new campus to better accommodate and be more age-friendly as well. So just a huge shout out to the teams that have brought this to us. This is not an easy certification, if you will, to get. And so we're really proud of the teams that have brought this. So next slide. So you may not know where we even are across the entire county. It wasn't that long ago on the map on the right-hand side, you would really see an orange dot there located in the city of Orange where I stand today. And you'd see a few of these little plus marks scattered around. But just over the last few years, there's been dramatic expansion. And quite frankly, we're going to where the people are. You should no longer have to fight the traffic, whatever traffic that may be, to go from routine items or even for more complex cases like cancer care, for example. We want to bring those services to you. And that's really what you see represented on that slide as we continue to fan out across the county. You see a new location down at the very bottom right-hand corner. That's right near Laguna Hills and Laguna Woods. That'll open actually in the next 45 days, for example, and that will feed back to this new campus site located in Irvine or up to the Orange location as well. We continue to survey the market. We plan to open roughly two sites per year on the outpatient settings, again, to make it easier for you to access. I call that ease of use. Easy for you to use, schedule, get an appointment, get there, be seen by our amazing providers closer to home, and then get out. That's our goal. So next slide, please. So now we're going to zoom in to the new campus that Steve mentioned. So you all know this location, I suspect, maybe better than I. So that is Jamboree Road, as you see on the left, and then on the right, we're starting to really lay out the campus. You can see it's going to be several different buildings, including 2 parking structures. The first building you'll see there is the CAC, Center for Advanced Care, all outpatient. It will go into construction first, be fronting Jamboree Road, and it'll have its own dedicated parking adjacent, and then we'll work our way down the rest of the site, and I'll walk you through that in a minute. But just a key takeaway, as I just mentioned, hospitals are hard to navigate. We know that. We're famous for designing the beautiful building and beautiful front door, and then putting parking like 7 miles away and hope you find your way back to the front door, right? So we're changing that. We're trying to make this a really more urban site with parking attached or immediately adjacent so that it's very, very easy for you or your loved one to come in, drop off, pick you up when it's time to go. Even imagine the airport with 2 levels of drop-offs and arrivals. We have actually that same thing set up here, that at the bottom level, you would pick someone up to get them out and just literally go straight out to the exit. So a lot of thoughts going into flow and ease of use as it relates to this entire campus. So next slide, please. In addition to that, access is huge, as I mentioned, and ease of use. What else are we doing and why are we doing this? So we know that the zip codes around Irvine and South are some of the highest growing when we think about census data. So we know that we need to be there to help meet the demand. And we also have it broken out by the demographics, and there's growth on really both ends of the spectrum. And so we're wanting to make sure that we have the right services in this location. So again, to minimize the travel and distances that people need to go for their care. We certainly have an issue about capacity here in Orange today. We are full. I have 27 patients in the emergency department awaiting beds, and we are full. So that means we got to move more patients through so that we can bring those patients in and start it all over again tomorrow and the next day and the next day. So this creates capacity not only on the inpatient side, but also on the outpatient side that we really needed pre-COVID and certainly through COVID. I guess the only other thing I'd point out, and Steve mentioned this, is just the physical location, being so proximate to the main campus, allows us to work differently. I mean, we're 12 miles apart today, and there's some days because of the freeway that feels like an hour and a half. So I can only imagine how our researchers, our educators, and our providers will work together differently just by being so physically close, and what that will do to the care that we provide there. So a really unique opportunity. You don't get to do this every year, thank goodness, because it's such a huge project. Next slide, please. So what this means to you. So again, we're bringing the experts from Orange down to Irvine to access you and point south, right? That's really the point. We want to make it easier for you to get that appointment, get in, get out, and again, bring the expertise to you. This is not the easiest place to navigate up here in Orange. We know that. It's a site that's been added onto over years, and traditional hospital campuses are just hard. So we're trying to bring this focus, these experts to you in a very simplified way, and really bring services that just don't exist at the same level to this location as well. So next slide. So we're in design right now for all these buildings and the parking structures and the entire layout. And normally we would meet with our design teams in person, much like we would normally probably be meeting in person. And design teams thrive on getting key sort of words and imagery together as they go off and then do their design work. And so we did a really neat exercise with our physician leaders and others of my executive team to come up with 4 key words that drove really the design work that's happening. So it's got to really integrate into this amazing natural site that we have. We're going to maximize the views. We're going to maximize the marsh and access for walking trails and paths to get you out of the building. So how do we blur inside and out together so you don't feel like you're stuck in an old white box of an institution, for example? We want to make it very simple, back to my ease of use idea and ease of access. Simple and easy to navigate, but also just the way it feels when you look at the building. Simplicity to me in design also means it's not something that's just a fad, right? It will stand the test of time. So that's another piece from a design element. We want to make it warm and inviting. These are big structures. You'll hear in a minute, hundreds of thousands of square feet, right, going on this site. So that can be intimidating alone. So making it feel very warm and inviting at the pedestrian scale, at the vehicular scale, and all the way throughout the experience. And then finally, we're in medicine. We're at the knife's edge. So we want to be as cutting edge from a building design spaces as possible, and make sure that, again, that is timeless at the same time. So those are the design features that we're focusing our teams on. And we check this. We do a gut check with the design team about every 2 weeks. How are we doing in these categories to make sure we're staying on track? Next slide. I get this question a lot. So what have you learned through the pandemic? It's going to make you design things differently. I could probably take an hour and tell you what we've learned through the pandemic. So I'll just highlight one here that I think is so important, which is the first one on the left, which is you heard all the news about the need for ICU beds. It was in the paper, on the news every day during the surges. And we did an amazing job here in Orange to convert non-intensive care unit beds into intensive care unit by changing staffing and bringing in additional technology. Tremendous. We boosted our bed count by close to 40%. Incredible. And we handled the surge expertly well, as Steve shared some of the outcomes. But wouldn't it be nice when you get to design a new building to make every patient room what I like to call ICU adaptable, so that literally with the flip of a switch and an additional staff member, it's now an ICU. And that's how we're designing this entire 144 bed hospital. You don't get a chance to do that. It's really hard to renovate and do that. So the learning was, we know we're going to need more ICU beds for the next pandemic or whatever we think the future will hold. You can see some other examples there of things that we're doing, and many more, like speeding up elevators. We don't want you sitting in an enclosed box. Vertical transportation needs to move faster to eliminate the amount of time together in small spaces, for example, and many more. So next slide. So the Center for Advanced Care, as I mentioned, is the first building. This is a hot off the press rendering. It's still changing, so don't hold me to this exactly, but this is the latest from just a week and a half ago. So let's go to the next slide, please, Ryan. And some shots about how the inside is shaping up and the key services that are going to be at this site. So again, first building to be constructed and open, all outpatient focused. It'll be your neighbor right on the face of Jamboree Road. You can see the key clinical service lines: digestive health, our Center for Children's Health, some primary and multi-specialty care, including neurosciences, orthopedics, spine, and pain. It's about a 165,000 square foot building, over 100 exam rooms, a large outpatient center, including shelled space for growth. We are famous in healthcare for taking a long time to design, build, and regulators to certify and open. And then by that time, we needed more space. It's kind of like adding lanes on the freeway. So we're trying to build in additional space now so that we're not finding ourselves in that pinch point by the time we open. So next slide. Now we move to the Cancer Center and the Ambulatory Care Center right across the driveway. So let's go to the next slide. So this is a comprehensive cancer center scattered throughout this building. We have radiation oncology, for example, down on the bottom floor. We have a surgery center also on the bottom floor that will integrate into the main hospital surgery platform. You can see 10 operating rooms for that. And then we have the full-fledged cancer center. What I mean by that is you got radiation oncology on the bottom floor, but then you have cancer clinics and cancer infusion, all happening together with high-end imaging as well as laboratory services. So everything you need for cancer is a one-stop shop within this building, as well as some other services like surgery if it was required. And again, shelled floor for growth, because we know, unfortunately, the demand for cancer services is growing, and we want to make sure that we can grow with that over time. Next slide, please. So now we zoom into the hospital. It's last. It takes longer to design it, longer to build it, and then longer for the licensure and regulatory bodies to give us whatever blessing and sign off that we need so that we can actually use it. And we actually build in several months just for that process alone. So it will open last. And so let's zoom into that next, Ryan. So again, the same key clinical service lines will be supported on the inpatient side: cancer, neurosciences, digestive health, orthopedics, and spine. As Steve and I mentioned earlier, it's 144 beds. Again, 420 roughly here today. We'll boost that to about 450 after this renovation is complete up here in Orange. 144 beds here at the new hospital in Irvine, as well as a 20-bay or 20 treatment room emergency department, and then 8 additional operating rooms on the inpatient side. So we had 10 on the outpatient, 8, they come together for a total of 18 operating rooms. It's close to 600,000 square feet when you combine those two buildings. So when you think about the 2 parking structures right adjacent, the Center for Advanced Care right on Jamboree Road, and this, we're talking well over 800,000 square feet of newly built space on this really tremendous site. Next slide. And maybe one of my favorites is how do we take advantage of this beautiful California weather and blur inside and out together, not just because of our learnings from the pandemic, but we do that here in Orange today. You wait outside and then we text you or come get you and bring you in. But we've created this beautiful plaza space that I just can't wait to have events in and educational sessions in, to really allow for folks to easily step outside, be close to their loved one, but take a phone call, have a cup of coffee, enjoy a really tremendous view over the marsh, and not be stuck in the stuffy old building at the same time. So this is one example, the biggest single example of an outdoor space that we're creating between the buildings. Next slide, please. This is just another image of what it might look like at night. These are hot off the press as well, trying to really make sure that the building shows well from the street so that when you turn in, you can see exactly where you need to go. Back to that ease of use idea. And then one more slide. We just last week hosted a really amazing session. We probably needed some younger teenagers in the room to show us how to work this, but these were virtual reality goggles with controls in each hand. What you see here is our leaders from surgery and anesthesia really standing in the operating room virtually. That's we have now designed, not yet built, and moving equipment around, making sure there's enough clearances, making sure there's enough space for their teams, making sure the room is laid out perfectly in the design stage today, because can you imagine how much it costs to build an OR? Wait till we get in there and then we have to change it because we didn't test it like this. Extremely expensive, delays your project, slows it down, and we know we want to get these services there as effectively and efficiently as possible. This type of technology in this virtual environment allows us to get that right now so we can go straight to the finish line. It was really amazing to watch. They were kind of like kids. They were moving around through the room. They were grabbing the lights, the booms, moving equipment around, and really testing the space in this virtual environment. We'll continue to do that for some other spaces that are high dollar and highly complex as well. But in the end, it saves time and it saves money and gets us a better product. Next slide. I think I'll wrap up here. So quickly, just to zoom back out, you can see the main campus off in the distance. You see the Center for Advanced Care on the bottom right will happen and open in early 23. Again, all outpatient. Then you're going to see the Comprehensive Cancer and Ambulatory Care Center open really about 10 months later, before the end of 23. And then, as I mentioned, the hospital and the emergency department just takes longer to open it, will happen around the end or fourth quarter of 2025. So you'll start to see some chaos. I like to call that great and wonderful chaos with heavy machinery moving in this summer on this site so that we can get that Center for Advanced Care set up and start to do a lot of the infrastructure, the stuff that goes below ground that we hope to never see once we bury it. So we set up for the other buildings to come in over time. So I think I'll stop there. I think we just have one more slide to close this out, Ryan. Perfect. So I would love to answer any questions, and I'm sure Steve would as we go forward. But Hal, I think I turn it back over to you. Thank you so much for allowing me to be with you this morning.
Thank you. This is an amazing morning to see what's happening here in our backyard in Orange County and what to look forward to in the next 4 or 5 years. This was certainly an eye-opener. Jerry, you want to handle questions now?
Yes, I will take the questions. And again, I'm very impressed and I really appreciate all this information about what we can look forward to in the future. So the first question is just a comment. We both share in the name Merage JCC on the Samueli campus is our name, and generosity of the Samueli family. So that was a comment from Mike Lefkowitz. And then Carolyn said, oh, these are all comments, not questions, but I'll get to the questions. We're so fortunate to live in this amazing, generous community. We are very grateful. And now the first question is from Karen, who says, do you share your info with Hoag?
That's a great question. We can both, Chad and I both can answer it from different standpoints. Can I go first?
Please.
So one of the ways we share with Hoag is that we train the physicians who then stay in Orange County. So I see them as my children. And your children are wonderful and you're proud of them. When I talk about the strengths and sharing information between a place like an academic health center and a Hoag, I'm not trying to say anything bad about a Hoag, it's just different. So when we talk about cancer chemotherapy, when we talk about cancer, for example, one of the things we do here extensively are clinical trials. Now, when you think of clinical trials, maybe you get nervous. You say, oh my God, is there a placebo and a real treatment? That's not the way it works in cancer. In cancer, it's the best known treatment and what we all believe is going to be the next advance to change it. And then in that environment, we also have specialists. So in our case, Rick Van Etten, who runs the cancer center, will have seen 100 cases of a type of leukemia that one of our trainees at Hoag may see one of in a career. So of course, everything about healthcare is collaborative. We make sure that the patient gets the best case, the best care at the right time and the right place, and we always work together. But it's critical to make sure who's doing which part of that. And then on the ground and day to day, Chad is much more engaged with the local hospital community, so he can really speak to that.
Yeah, thank you, Steve. That's very well said. And Karen, I want to make sure I understand your thought there in the question. Are you thinking about medical record sharing when you say sharing, or what? If you wouldn't mind coming off mute maybe and telling us a little bit more about what was in your mind, if you're still available. But I'll tell you, we certainly do share a lot of information back and forth with our colleagues, not just at Hoag, by the way, at many other places. And we've been working very closely with all the OC-based hospitals through the pandemic, something that we led to bring the hospitals together to really share best practices as well, just from the pandemic perspective. But Karen, I see you're back. You want to elaborate a little bit more on your question for me?
No, I meant medical information, and not necessarily about the pandemic. Like if you do one of your clinical trials and all of a sudden you find out this is promising, do you share that with Hoag? Do you offer Hoag to let their patients even into some of your clinical trials?
Yeah, that's a great question. And just at a personal individual level, we through our IT systems, more and more are coming onto the same platform across the entire county, actually. So it makes it even easier to share. You know, if I went to the emergency department here today and then showed up in the emergency department at Hoag 3 days from now, that we could share that information. That's a very important continuity piece that's happening thanks to electronic medical records and that we're knitting together. And Hoag and all the Providence systems are starting to do that as well.
And I have another follow-up question. Some of the doctors call themselves from Keck. Is Keck affiliated with UCI?
Nope, Keck is USC, totally unaffiliated with any of the UCs. And they have a partnership with Hoag to bring some of their cancer specialists down and rotate through Orange County and then go back to the mothership at Keck Medicine at USC as well. Great question. And I see there's a question also from Sheila about where is the site? If I may, Jerry, jump back to a slide. Sorry to take over that question, but I just thought maybe a slide is worth answering that. So hopefully Sheila and team can see that. So the best way to think about this, it is right near you at the JCC. That's Jamboree Road, going sort of in the corner of the site there. Ryan, if you could point for that, thank you. And then you see it, that would of course terminate down at, I like to say it terminates at Balboa Island, right? And you go all the way down. So this is right on the corner of Jamboree and Campus, right? And
so for those of us who are really only 2 years in and don't know, it's like the back of our hand. Google is on one corner over there. Like there's the Lexus, the Google, and then you keep moving towards the ocean just a bit, and that's where we're building.
Yeah, great point. It's about 40-acre plot, and we're starting to develop about half of that for this as well.
There was a question I received that kind of goes off your partnership with Hoag, but also there's a question about your partnerships with other UCs and research places. What kind of, how do you share research amongst research institutions?
Yeah, Steve, go ahead.
I'll start again. It is one of those great hidden strengths. I mean, we have a comprehensive NCI designated cancer center. There are 49 of those in the nation. 5 of them are in the University of California. So when we connect together those, which now in a virtual world is very easy, you can imagine the quality of second opinions, of moving things forward, of collaboration. Together, we're bigger than any other entity caring for cancer in the country. So it is one of our great strengths. And as we now move into the world more aggressively of using data the way I described for COVID, now we've got the entire UC system collaborating in terms of research advances, but it also helps in terms of the access, the ability, and the quality of the healthcare at the sites, because Chad and I meet with our compatriots virtually every Monday and Friday morning to talk about how we can each learn from each other best practices to move things forward.
Thank you.
That's perfect. One other thing I'll add is that I think there's power and strength in numbers. That's just to underscore what Steve just said. And we absolutely try and leverage the broader UCs. Again, the 5 NCI designated cancer centers are a wonderful example. There's no other combined cancer entity like that. And so we work very closely across all 5.
And there's a question now from Dr. Berman. What effect do you see with City of Hope also coming to Irvine, and do you plan on collaborating with them?
Yeah, I think that's a great question. And the fact is, unfortunately, the incidence rate for cancer continues to rise. And so folks like City of Hope are also very good at treating cancer, want to get in and help stem that tide, right? So I'm not surprised that they, or to Karen's question earlier about USC and others, want to be here in this marketplace. We're also rapidly growing. I don't know what the new census will show, but we'll be north of probably 3.3 or 3.4 million people. So we expect them to come into the market, focus first on outpatient care, and they're going to need to partner with someone for inpatient needs or send the patients back to Duarte, which when you think about my ease of use idea, that's not super easy. So my hope is that they'll be hopeful and wanting to partner on an inpatient side until they built build their inpatient campus in time as well.
Yeah, and again, I don't want to sound critical. I want to just talk differentially. City of Hope does some things extraordinarily well. They do not cover the terrain of cancers the way that we do. And in addition, they are going to be, their home base is someplace else. So if something complicated is happening, they're going to need to move people up again out of the community. So all healthcare is good and all collaboration is good. But I'm just making the case that what you guys built and I get to be part of now at UCI is really extraordinary, for Orange County and the nation.
Thank you. I have a question about the growing population of older adults in this area. And you mentioned older adult services and gerontology. And I'm wondering if you could speak a little more specifically about what you plan on offering that growing population.
Yeah, I'll start, Steve, if you'd like. And
sure.
So I wish Dr. Cindy Hawk, who's the chair of family medicine, the Department of Family Medicine, the School of Medicine, she could take many hours and give you lots more detail on that, Jerry. And maybe we include her in the speaker series, actually, because she's wonderful at that, maybe her and a teammate. But absolutely, she and her colleagues are extremely focused on meeting the needs of the community first. And of course, that means a diverse age range. And then she has specific faculty members who are experts within the gerontology field as well. And so I don't think I would do it much more than a disservice to give you much more details, but let's park that, Jerry, and just know that not just that certification that I mentioned at the start, that's a very important part of everything that we're planning, and let's have her come back and give more detail, okay?
Thank you.
Yeah, and you know, again, my job, I feel like now I'm standing on a soapbox, but in the nation, we stand head and shoulders above most and are ranked so highly in geriatric care. So it's something for us to be very proud of. Yeah, but yes, let's expand on it with a full session.
Thank you. There's another comment. There are major medical research advances coming out of Israel. What interfaces do you have with those institutions, specifically with cancer?
That's a great question. I mean, one of the things that a research university does is it has its outreach all around the world to where the most advanced work is happening. And Israel is a place that we're connected to in many different ways. One is the leading edge of the researchers or the clinicians themselves. I mean, so personally, it's because of COVID, it's been delayed, but I have my former trainees and my collaborators at 4 different universities in Israel. So I go there, I talk to those people, and we collaborate. But that's true across all of our disciplines, because the most advanced work is work that resonates in. I also know that the Samuelis are very dedicated to their investments include, as a highlight, cancer care in Israel. So there's another connection through the Samueli Institute. I'm sure there are others. I don't know, Chad, if you have other direct knowledge.
Yeah, not limited to Israel at all, but that's an excellent couple of examples that I'm aware of as well.
Okay, I don't believe there are any other questions. Would anybody like to wave and before we end, because we actually only have a few more minutes, I can ask you to unmute if you wave. Is that you, Mike? Okay, here we go.
Jerry, I have a couple of questions in my box. There was one about, I mean, right now, in terms of the global health crisis, we see some very scary numbers coming out of India. What are we learning? What are we doing? How are we protecting ourselves? What is that? How is that informing our medical care?
You want to start, Chad, or me?
Go ahead, I'll follow on.
I think you're right to be watching it. Unfortunately, infectious disease is something that we share globally. And so we have to help each other be safe. I think that the emergence of variants is something we're all going to watch very carefully. I think that it is likely, although Dr. Fauci isn't willing to say it yet because he knows someone will yell at him if he says it and he's not right. We're probably talking about booster shots, because if other variants grow, even though we're immune now, we may need to protect ourselves around what comes around next. So looking forward, what happened in COVID in the academic research environment is something just remarkable to look at. I think we should all be proud for our investments over the last 40 years, because on a dime, we turned around, took what we knew how to do, analyzed the virus, got its genome sequence, judged what would be the antigens we needed to pay attention to, developed vaccines, tested them, and we have vaccines that are better than any other vaccines we've ever seen before and safer than anything we've ever seen before because of the nature of what we're putting in. That all happened as we were developing other strategies and as people like Chad were on a dime turning the way healthcare is provided so that we could manage it. I think it was such a tour de force for what we are able to do when given the possibility. But back to the question, I think the answer is just by putting on masks, washing our hands, and social distancing, of course, we protected ourselves. We can't stop paying attention to that when the risk is still out there. And I suspect that we need to help the rest of the world the way we've always tried to do in America. And I suspect it's going to be the reason that this floats around in the environment instead of being rapidly suppressed.
Yeah, I'll just add, Julie, thanks for that question as well, that would you believe that we had virtually no flu cases here at the medical center? Well, why is that? Well, it's because social distancing, washing your hands, and wearing a mask, right? So we know that that works. We also know that we learn from our colleagues around the country. And so it was actually early January of 2020, pre-pandemic, as it was even known, that something was bubbling out of Asia. And our infectious disease experts were already tracking that thing that was not yet even labeled as COVID or coronavirus issue. And so we're obviously tracking what's happening in India through their connections as well and learning from them, and also offering our expertise that Steve shared with you from the outset as well. So I don't know that we ever get off of this treadmill, right? We're going to be watching this and learning and providing feedback as we go forward.
Thank you. Mike Lefkowitz, you had a comment.
Thanks, Jerry. First of all, I just want to give a personal shout out, thank you, to Dr. Tawari at your institution, who excuse me, has been treating my wife, Sheila. Thank you, guys.
Thank you, Mike.